this video, I'm going to be demonstrating the gait deviation of excessive hip flexion or insufficient hip extension. So I'm first going to demonstrate the gait deviation in a couple gait cycles, and then I'm going to break it down by the phases affected and then the functional tasks and task accomplishments affected. Some of the potential causes for this gait deviation are decreased hip extension, passive range of motion, or excessive ankle dorsiflexion, or insufficient ankle plantar flexion. We also have excessive knee flexion or insufficient knee extension, and then also hip pain, someone trying to compensate for hip pain, maybe in that excessive flex posture, or may not be able to sufficiently extend their hip. So first off, here's the gait deviation. We have that decreased hip extension coming out, that increased hip flexion, but mostly we have that decreased hip extension or that insufficient hip extension. So first phase affected is going to be the loading response. So we have initial contact, loading response. So overall, this gait deviation is going to decrease stride length in general, but that loading response, the functional task being affected is weight acceptance, and the task accomplishments would be shock absorption, forward progression, and just general stability on that limb. So this is going to be affected because we have an increased demand on the quadriceps and the hip extensors. So we're going to kind of have a decreased stability in that sense during that load. And then the next phase affected is going to be mid-stance. So for this, going to mid-stance, the functional task that's going to be affected is single limb support. The task accomplishments are going to be forward progression and just general stability. So this phase is affected because we have just overall decreased limb stability during this when we have that excessive hip flexion or that decreased extension, because during the mid stance we need 0 degrees of hip flexion, and the patient could already be in maybe 5 degrees of hip flexion during this phase. So the next phase affected is going to be terminal stance. So we have loading response, mid stance, terminal stance is going to be right here. So we have, with this, the functional task being affected is going to be that single limb support again, and task accomplishments are going to be forward progression and overall stability. So again, we're going to have decreased limb stability in this phase, and most importantly, we're also going to have more of an anterior pelvic tilt. So with this phase, we want 20 degrees of hip flexion, and which is mostly caused by that posterior pelvic tilt. So with a patient with excessive hip flexion, they're going to have more of an anterior tilt, and this is going to decrease that trailing limb ability. So we're not going to have as much extension as we should to be able to push off and increase that stride length. So we're going to have that decreased or insufficient hip extension and increased hip flexion. So we have that anterior tilt, decreased limb stability, and not enough extension as we need. So the next phase affected is going to be pre-swing. So that's going to be up like this. So the functional task that's going to, or the functional task being affected is going to be the swing limb advancement phase. So the task accomplishments affected are going to be foot clearance and limb advancement in general. So this is going to increase energy cost on that limb. So again, we're not going to be able to achieve that trailing limb. And also for this phase, we need 10 degrees of hip extension, which may be insufficient with someone who has excessive hip flexion. So we're not going to get that all the way back like it should be. So it should look like this. with that extension, but with someone with that excessive hip flexion or insufficient extension, it's going to look more like this, just less. You're going to just barely be able to notice it in some patients. In other patients, it may be more prominent because they may also have excessive knee flexion or excessive dorsiflexion. So the last phase that's going to be affected with excessive hip flexion is going to be that initial swing. So we have loading response, mid stance, terminal stance, pre-swing, and then that initial swing. So this again, the functional task being affected is going to be swing limb advancement again. Foot clearance and limb advancement are going to be affected as task accomplishments, and again, this is just going to have an increased energy cost on that limb. And again, we're not going to get that trailing limb. So overall, the patient's going to have decreased stride length and excessive hip flexion, so you can kind of see it in the sagittal phase. And you're just going to see that shorter stance or that shorter length because they can't achieve that extension.